Hi, Dr. Gonzalez here, reaching out to my referring providers and or providers I have referred a patient maybe out to for some therapy prior to a release of a tie. Of course, having a patient see me for a surgical release of a tie, be it tongue, cheek, or lip, requires some lifts afterwards to establish a new frenum development as opposed to the old attachment, which was a tie. To prevent that from reoccurring again, a lip tie, cheek, or tongue tie, I do want parents and patients to be dedicated to knowing they have 3 weeks, 4 times a day, every 6 hours, a 5-second lift off of the gingiva, upper lip or cheek, or off the floor of the mouth if it's a tongue. It's a 5-second lift. For a tongue, it requires pushing straight back on either side of the tongue with an index finger. Towards, in infants, I say the earlobes, but older kiddos, it may be more the corner of the mandible or angle of the mandible. We want to push straight back as far as the tongue will go comfortably until there is resistance made. For the first week, may not even be comfortable. It's going to be uncomfortable, let's be honest. And the patient needs to be able to adhere to that. A toddler may not. So bite block may be included. We do recommend bite blocks for purchase and reimbursement if a parent would like to return it to us following the lifts that they're doing. It's at least 3 weeks, 4 times a day for 5 seconds. And if after 3 weeks, the diamond or the diamond-shaped wound area is starting to look like it's very similar, actually the same coloration as the outlying tissue. You can just see a slight outline now. It's almost time to stop. I always say go a few days beyond that. Once you're there, you're done. It may be at 3 weeks, but if at 3 weeks it still looks white in the center of that diamond or close to diamond shaped lesion, we do want to go at least another week until we see that it's completely gone for at least a few days. 3 to 4 weeks is usually the optimal time for those lifts. That's what I love patients to be prepared for. For infants and older adults, it can be quite painful following the release. 1 to 3 days can be very sore, very painful, and about the first week is tricky. Older adults may do more softer foods for eating, especially under a tongue and or lip tie, whereas infants may have to resort to even syringe feeding from a parent, slowly syringing in the breast milk into the vestibule between the cheek and the gum pad, slowly, knowing some will come out, but be persistent and keep doing that. Some infants won't have any problems, and some actually do great right away and do an improved latch, improved breastfeeding, but most we won't see improvements until at least 2 to 3 weeks of healing. So we don't want parents to assume that they're going to have an immediate kind of a resolving of symptoms or improvement, but it is going to be over time, especially for the patients that have more neuromuscular coordination to work on. Those are the infants or young adults that maybe their speech isn't anywhere close to being normal, and or an infant won't even attempt to latch to a finger and has very slow, improper peristalsis of the tongue, more of a thrusting anteriorly. Those patients are going to require much more time and a lot more emphasis and practice for the parents too on lifting the lip each time it rolls under during breastfeeding. Every single time they're breastfeeding, bottle, passy, whatever it is, if they are diligent and make sure they lift it, it will help the infant to realize that they can actually lift it now on their own, but it may take some time. So again, just letting parents know it's not instantaneous. It may not even be an improvement, but we've never seen anything get worse. We've always seen at least status quo or quite significant improvements in speech, swallowing, obviously feeding, whatever that is our mission, gag reflex, acid reflex, whatever our mission is to resolve, we never see it get worse. So with a frenum release, we hope for the best, expect the worst as far as pain control, wound management, exercise, lifting the tongue, lifting the lip, and exercising muscles with be it either a lactation consultant who can show parents how to strengthen the lip, the tongue, a speech therapist, occupational therapists who can show parents and children what they need to do in order to increase certain habits and decrease others, tongue thrusting per se. think just follow up with that same referring provider would be wonderful for wound management. If you're comfortable doing that wound management and you know when you're doing it, especially within that first week, with a proper lift, which under the tongue is a push, or lifting the lip up, with that proper management from you, you may, and I always tell parents beforehand, looks great, feels great, I don't expect bleeding. Doesn't look great, doesn't feel great, I expect some bleeding after I do my exercise. Are you okay with that? If you're not, a release again with a revision would be necessary with a laser. Most parents are really comfortable knowing that it may bleed slightly after, but it's always a good thing for those that are doing the wound management, especially if it's not me, to let parents know that and be comfortable themselves to glove up and do that lift, whatever is necessary. I do have a video of a infant having their tongue basically pressured, the lifting on it, and how that push is actually lifting. But if you'll bear with me, I'll go wash my hands immediately after this. This is what I would want you to show a patient. For a cheek tie, which are pretty rare, but I do sometimes release those if they're really tight, tense, and limiting the mouth opening for speaking or feeding, you would do a push hug. 1, 2, 3, 4, 5. And if it's a lip tie, especially at the midline or lower lip tie, same thing. I'll show for the upper because it's a little easier. You do both index fingers, lift up. For babies, cover their nose holes. For adults, attempt to, and you most often can. And it's a good strong stretch. 5 seconds there. Tongue, both fingers. We're going to go in, lift the tongue up. And it's really uncomfortable, even when you have not just had a release. Thank you all. I hope that helps a little bit on what I would love to be able to do together, getting patients prepared and families for the release beforehand. Thank you so much, and do call me if you have any further questions, ideas, or suggestions. Thank you very much.